This week on The Week Ahead, we'll speak with ALG Counsel Nathan Mehrens about the plan in Congress to repeal Obamacare. Plus, hear from Georgia Congressman Phil Gingrey about another way to save money in the healthcare business. Welcome to The Week Ahead. I'm Frank McCaffrey. When President Barack Obama took office in 2009, instituting a government-run healthcare program was atop his priority list. Now, a new Congress has made repealing that law atop its priority list, and this week is when they plan to make it happen. For more on this, we're joined by Americans for Limited Government Counsel, Nathan Mehrens. Nathan, do you really think that a repeal of this healthcare program, or Obamacare as it's known, could really get past the Senate that's essentially run by Harry Reid?
I think it'll be very difficult to get a full repeal through the current Senate. There are only 47 Republicans in the Senate as it's currently composed. I think what's more likely to happen is that there will be individual component parts of the act that will be sliced off and dealt with individually. And that's, there are a couple of areas where that could occur. There are a couple of IRS requirements that were inserted into the bill, things that had nothing to do with health care. That's probably some of the easy targets, and so look for that. But the Democrats have really dug their heels in, and they're basically said to Republicans, forget it, don't even go there. So I think it'll be very difficult, but it's definitely a fight that should be tried, that's for sure.
Nathan, the states of Maine and New Hampshire have instituted a waiver for Obamacare. What does this national program mean to state governments?
The specific waiver here, in the application for it, the states are certifying to the federal government that certain requirements under Obamacare will cause a destabilizing effect on their state insurance markets. So that's pretty clear, and these aren't exactly real hard right states. Maine and New Hampshire are fairly centrist states, and their own state officials have recognized that on this particular issue, that a large damage to their own individual market is going to occur. It's interesting to note that these aren't the only two states that are going to do this. There are estimates of up to 20 states that are going to be asking for this waiver. So at the state level, many officials certainly are seeing the problem.
Do you know of any major company or unions that have instituted a waiver for Obamacare?
There are a number of large companies that have asked for waivers regarding certain types of insurance plans that they have, most notably what's sort of known as the mini-med plans that provide a minimal level of coverage. McDonald's, for instance, has asked for a waiver for its plans. There are a few unions that have asked for waivers as well. The companies that have asked for waivers are essentially saying that but for the waiver, this insurance is going away. We can't afford to make this insurance available to our employees unless we have a waiver from certain of the requirements. So the option is no insurance, or the insurance level that we have now, which may not be comprehensive insurance, but it's still better than nothing. So both large companies and states as a whole are recognizing the large costs that are a result of this legislation.
All right, thank you very much, Nathan. There are other concerns about government regulation in the medical industry, including the rules that surround medical malpractice in America. Americans for Limited Government spoke with Georgia Congressman Phil Gingrey, also a doctor, about medical malpractice reform. Lawmakers on Capitol Hill are increasingly recognizing the need for medical malpractice reform. According to government estimates, reform could save Americans $53 billion over 10 years. Though many cynical conservatives believe that it would be tough to make the left-wingers in power give in and let reform go through, Georgia Congressman Phil Gingrey thinks we'd be surprised to know it can happen.
Think back, what was it, in the early 80s when the catastrophic coverage bill was passed, when Dan Rostenkowski was the chairman of the Ways and Means Committee, a powerful Democrat. And I guess that bill, which gave catastrophic coverage under Medicare to seniors, but it raised their Part B premium astronomically. It took them about a year of beating on the hood of Representative Rostenkowski's car in the suburbs of Chicago. And then that bill came back to a Democratic Congress and was repealed.
Gingrey believes that the best of the medical profession is often not seen, and a great deal of this is due to fear of medical malpractice legal problems.
You're not seeing the best and brightest young people, not even going to medical school, but certainly not going into high-risk specialties like neurosurgery and OBGYN. Emergency room doctors will tell you that they can't find a neurosurgeon in many instances when people come in with a massive head injury from a car wreck, and it's because of the liability factor.
There's a lot of talk about healthcare these days. Medical malpractice reform is a way to help those who need to save money on health costs.
It's driving up the cost of health care because of the defensive medicine, where doctors feel that they have to order a gazillion tests when 2 would probably suffice, because they know of colleagues who have been dragged into court and so-called expert witnesses come and say, oh, well, that doctor clearly practiced below the standard of care because he never ordered a fissile phosphate level on the patient. I'm being facetious there, but clearly the ordering of too many tests, it runs up the cost of health care, and it could be downright dangerous to the patient's health. You could bleed them out ordering so many blood tests.
Representative Gingrey is planning to introduce a bill to address medical malpractice concerns in America. This is modeled after a law in the state of California.
The reason we have chosen that, and our leadership has chosen that bill and asked me to present it once again, is because, by golly, it worked. And the malpractice rates have come down and stabilized in California over these last 30 years, and the physician workforce is solid there. They're not in a crisis situation.
Gingrey's medical specialty is as an OBGYN. He practiced for 31 years and delivered approximately 5,200 babies. And now we move to a look at possible government cutbacks. Texas Representative Kevin Brady has introduced legislation to cut the federal workforce by 10%. While unions and Democrats are saying that this bill equals doom and gloom, Americans for Limited Government President Bill Wilson is commending Brady. Brady is the chair of the House Joint Economic Committee. Sorry to say it, but a lot of non-government employees have had to make cutbacks at home since late 2007 when the recession started, and a lot of those cuts have been a lot more than just 10%, and that's all the time we have for the week ahead. Please join us again next time. For more on these and other topics, visit our webpage, getliberty.org.